Today we're going to talk about ankle sprains. And an ankle sprain will oftentimes occur when you're jumping and landing and you go out onto the outside of your ankle, tripping on a step, or oftentimes playing sport in netball, basketball, where you step on somebody else's foot and your foot goes onto the outside and you sprain the ligaments around this area. You'll oftentimes sprain the front ligament and the outside ligament here. The other thing that will oftentimes occur when you sprain your ankle, and this is an ankle joint, that's the joint like so, is that you will also obviously go over on the ankle like so and sprain these ligaments on the outside, but you can also jam the joints on the inside of the ankle, and this will produce pain right through the inside here, because you tear the ligaments on the outside and jam the joints on the inside. When this often occurs, you'll get pain and swelling. A plain x-ray will identify whether there's any major fractures in the ankle. It won't show ligamentous injury. In youngsters who are under the age of 14, 15, we would suggest a plain x-ray often. And if we do an x-ray in that age group, they need to do both sides so that we can compare the growth plates on both sides. For an adult, if the patient's having pain walking, difficulty putting weight on it, we would advise an x-ray. And in youngsters, we would often as well, because they're more likely to have broken a bone. And the same can be said with older people, because their bones are a little bit more brittle. We also need to be a little bit careful when you sprain your ankle. This is obviously a foot joint, that when you sprain, you can often break this bone on the outside. So you may feel pain on the outside of the ankle joint, but you can also have a fracture through what we call the fifth metatarsal. When you are doing a plain x-ray of the ankle, make sure also that you don't just do an x-ray of the ankle joint, but we need a full x-ray of the knee, right up to the knee. Sometimes you can get what we call a secondary spiral fracture that's often missed. Once an ankle injury has occurred and we're confident that there's no fracture, we start the process of rehabilitation. And we know from past experience, putting you into a cast will oftentimes not be beneficial to your recovery. So we would advise post-injury that compression to help minimize the swelling. We then would recommend that you start to progressively weight bear. If you're on crutches, that we progress you pretty quickly onto a weight bearing position, starting to walk. When you are starting to walk initially, if you need to have some support, either through a cam walker boot that's like a ski boot, or even taping can also help transition you through that initial period. There's recent research suggesting that the use of ice with ankle sprains is actually detrimental. Ice generally is used to reduce inflammation and pain. What we would be suggesting, probably the most important thing from an inflammation or swelling perspective, is to use compression. So a fairly firm bandage or a compressives type sock like a Tubi grip. Rehabilitation basically in the next 6 weeks, in 80% of cases, if performed conservatively, will produce a very good result. Conservative treatment, so far as physiotherapy goes, will include increasing the movement of the ankle. So physiotherapy techniques to help move the ankle, stretching the muscles around the ankle, moving the small joints. There's lots of little joints in the front of the foot. A strengthening program for the calf, quad, hamstring, gluteal muscles, which have a lot to do with balance and stability, and some core strengthening. We will go through a program for approximately 4 to 6 weeks to increase the range of movement, the strength and the balance. Once we get to 6 weeks down the track and we have very good range of motion, then we can start you on what we call a pre-jumping program for 2 or 3 weeks, and then onto a full jumping program, which includes change of direction. From here, we can then blend in a running program. In almost all cases following an ankle sprain, we advise you on your return to use taping on both the affected side and the non-affected side if you're returning to change of direction activities. There's a high risk in the future in actually re-injuring both ankles. Why tape the other side, the non-affected side? Because when you return to sport, you have a much higher likelihood now of changing your jumping to land on your good side. So we like you to tape both ankles. On that note, how effective is taping in reducing ankle injuries in the future? It's very effective. We think that ankle taping is superior to ankle bracing. Ankle bracing, unfortunately, can turn some of the muscles off that help you in the shock absorption capacity of landing and jumping and takeoff. So ankle taping is very useful, and we will show you some videos later that will help facilitate this when you return to sport. As I said before, I've said many times, prevention is better than cure. Preventing these injuries in the future is useful, and especially on the other side when we go back to these activities. When we actually look at down the track, sometimes why ankle injuries don't respond well to physiotherapy, and we think that's in about 20% of cases. They don't respond well because sometimes the ligaments that are torn produce too much instability in the ankle, and you keep spraining your ankle in future instances, either walking down the road or when you are playing sport. And recurring instability, if we're not able to strengthen it well enough, and if the taping and bracing hasn't worked, these result in a reconstruction. It's usually called what we call a Brostrom-Gould reconstruction, where they reconstruct the two ligaments on the outside. Now, in the cases also where you get recurrent ankle sprains, often you don't just get this instability with the ligaments, but inside the joint, you can also get scar tissue, which produces pain when you're moving your ankle. And this video that I'm just about to show you here actually shows you an arthroscope inside the ankle. And what one can see here is this is a little size of a chopstick, is a little device that's sucking out this scar tissue, which is the scar tissue inside the ankle. This is all scar tissue which forms within the ankle, and we need to suck that out if you were to have surgery in about 20% of cases. That's what we mean when we talk about scar tissue within an ankle down the track. However, basic ankle sprains in 80% of cases do well with conservative treatment, manual therapy to increase the range, strengthening to increase the muscles around the lower leg, and balance exercises, and a progressive return to sport. The use of an anti-inflammatory in the early phases, we don't generally tend to recommend because it reduces some of the normal inflammatory response that will help with healing. We hope this has been useful for you. Certainly if you have any further questions, don't hesitate to ask any of our staff at OrthoMed Physio. Thank you and good day.